absent. Once again, my name is Taiwo Baruwa. Today on the program, we shall be talking World Malaria Day, accelerating the fight against malaria for a healthier future. My guest is not a newbie to the microphone. I have Dr. Kelvin Isibo in the building this afternoon. Good afternoon to you, Doctor.
Good afternoon, Ma.
How are you today?
I'm fine.
Are you cold?
Not really.
David, please bring the coffee. Okay, should we go the fire with Share Rojo? Did you see the rain?
I did not do.
All right, then, Lagos. The roads are wet, so let's keep it safe out there. Keep it within the speed limit, even as you move in and around the Lagos metropolis. You know, I see the traffic managers doing the yeoman's job there, so please, let's obey them. Let's cooperate with them. You know, you are in your car, you are in the bus. They are just under the rain there, you know, just to ensure that you have good flow. So please, cooperate with them so you can at least have an appreciable movement. The roads are wet, some areas are flooded, and so this certainly would slow down vehicular movement, especially as we approach the peak period. So please, let's keep it that way. All right, I said earlier that my guest is not a newbie to the microphone. Dr. Kelvin Isibo is a practicing medical doctor and a writer in Nigeria. He works in a dialysis center and attends to patients with various skin conditions. He is involved in health education on radio and television, and he is passionate about community mobilization and school health programs that involve eye screening, ear screening, and overall school health to improve children's academic performance. He is the founder of Life Towers Medical Consult, an organization that helps people to meet their health needs and helps to provide health coverage amidst the challenges of scarcity of health workers. Once again, good afternoon, Doctor, and welcome to the show. Let's talk malaria. Malaria sounds like we're talking. It sounds like we're talking rice in Nigeria. I mean, when you say rice, it's a common staple, or you say bread in Nigeria. So malaria is more or less like saying rice in Nigeria now. Is that the case for us? You know, do we have that immunity against malaria already, or what stage are we in the fight against malaria? Because it's not even new anymore.
Well, malaria is not new to us anymore. However, I think people tend to have respect more for disease that they don't know compared to disease that they know.
It is called see finish.
Yes, I think we have that. We don't see and finish.
Yeah,
so that's
we're
it.
like a desical.
Yes, there's still a lot of work to be done when it comes to malaria. However, we have improved from where we used to be. Unlike before, when we talk about the statistics, the epidemiology of malaria in Nigeria, we usually talk about deaths within minutes.
Okay.
We record death of a child every minute of the day in Nigeria, but now we cannot even give that statistics because we cannot calculate it in minutes. However, Nigeria, we still have the highest mortality rate when it comes to malaria. You know, of all the mortality rates in malaria in the world, Nigeria alone accounts for over 30% of the mortality rate.
Why is that?
That's because we still have a lot of work to do when it comes to malaria. And the truth is, when it comes, what we see in the media is what we usually see in the southwest, south, southeast, usually the south. We don't have a true picture of what Nigeria is compared to the north. They don't really give us those picture of what is actually going on in the north. You know, but overall, now we have about the last study that was done, 2021, 2022, about 68 million cases of malaria that was recorded, you know, and about 194,000 deaths recorded, you know, within that period, according to WHO.
Yes.
But before now, the statistics used to be like about 1.2 million you know, deaths.
Wow.
But now the deaths about 194. But 194, if your family member is one of the 194, then that 194 becomes significant. So there's still a lot of work to be done, but we are making progress. I think our health practitioner will deserve a round of applause. We have tried so far.
But then you mentioned something about, you know, the statistics of malaria prevalence in the north. As a medical professional, can you give a proper insight to what you mean by we do not have an understanding of what happens down the north?
Okay. No, we don't have enough health workers in the north compared to what we have in the south.
South, okay.
Despite the fact that we have more population in the north, but more of our health workers are concentrated in the south. You know, with the jackpot syndrome now that you have, you know, cut across every sector, not just health sector.
True.
That has worsened an already bad situation. But now, compared to the north, with the jackpot syndrome, then the kidnapping, whatever, terrorist activity in the north, a lot of people are not going to the north. You know, currently I have a friend that is going to the north to bury I cannot even go for the burial because of fear of kidnapping and things like that. You know, so in a place where you have a large population and you have very few doctors to attend to these people, that is one. Two, what is the educational status in a place where you declare like a month's public holiday because you want to celebrate an occasion? Their schools will not work, you know, and things like that. How do you educate these people that, okay, this is what you need to do in a place where education is not prioritized? And I'm surprised they could do it in a country where we have presidents, we have governors, and nothing is being done.
Anyway, we'll leave that to the policymakers, and I'm sure the people saddled with this responsibility are listening, because these people eventually, we have people who leave the south for the north for one reason or the other, and then we have people who migrate from the north down to the south for, you know, the same purpose. Let's now, I haven't said all of that, let's look at the basics now. For malaria, everything now is headache. I am stressed, it is headache. This one, it is headache. That, what are the common symptoms one should look out for, you know, when it comes to malaria, and at what point should one seek medical attention?
Well, if you ask me, I'll say at every point you are sick, it is good to seek a medical attention, because health sometimes is something that can move from 100 to 0, you know, and you can't really predict if. How do you tell if something is mild or moderate or severe? Because we have uncomplicated and complicated malaria.
Yes.
You know, it can present in various forms, but it is the job of the doctor to decide and say, oh, this malaria, is it mild or is it severe? You know, malaria can present in any form, but however, the common forms that we see is the uncomplicated one that comes with headache, fever, malaise, just feeling unwell, body pain, joint pain, vomiting, you know, diarrhea, you know, and things like that. These are non-specific symptoms. Even if you have viral illnesses, they can present like that, you know, and after some time it will go because it's a viral illness. But malaria usually presents like that. Now, the practice now is, if you see anybody presenting with malaria symptoms, do a test to confirm that it is malaria before you treat. You know. Okay. But when you are not sure, you don't know if it is malaria, how do you know what to do? Usually people will just try, buy malaria, take, and some don't even complete it. But basically those are the common symptoms. But malaria can present with any other symptoms that will tell you, oh, this is severe malaria. I think those are the ones people should focus on. Things like what we call prostration. According to the Yoruba people, when you want to greet, you have to prostrate. So in medicine, we use that. So we call it prostration. The person cannot sit unassisted. The person cannot stand unassisted. They are looking for ways to just lie down. They want to prostrate. So we call it prostration. Once you see that, that's giving you a sign that, oh, this is severe malaria. The person is having convulsion. The person is unconscious. The person is finding it difficult to breathe. The person is bleeding excessively. Oh, wow. Or the person is showing signs of renal function impairment. Because malaria can also affect it. So it can present in any form. Wow. You know, the blood level is very low and the fever is, you know, way higher than normal. All these are signs of complicated malaria. That, you know, you need to address other things in addition to the malaria itself that you want to, and you might need to do other tests to differentiate, oh, is it just the malaria or is something else? So but when you see those symptoms of complicated malaria, it shows these are some of the reasons why people should not use drug, just over-the-counter medication as the spirit leads.
For the sake of those who do not have the idea, what are some of the causes of malaria?
Well, usually when we want to talk about the cause of malaria, we are fond of blaming it on the mosquito. We hate mosquito with passion, but forgetting the fact that these mosquitoes readily do not have malaria. We infected them.
Really?
Yes. So the only thing they do is they pick the malaria from somebody that is infected with malaria
and then transfer it to another.
Person. The malaria will take one stage of its life cycle in their body, then complete the second stage of their life cycle in the next person. They pick from that other person. So if we treat our malaria very well, even if you are bitten by mosquito, the mosquito will not see the malaria to transfer for anybody. At least maybe it's only the music who will suffer. But the malaria will not be there.
That's even for those who even get to hear when they sleep.
Yes, but so now poor hygiene is also another factor.
Okay.
Because now, if your environment is clean, you sleep under treated net and things like that, there will not be mosquito in your surrounding to take malaria from you to another person.
Or from another person to you.
Yes, because mosquito will not be in your environment in the first place.
Sure.
So lifestyle is important. You don't leave stagnant water around you.
Mm-hmm.
So hygiene is also part of it. When you leave your place very dirty, you don't put mosquito nets, and you don't care about your health. You use your drug and you don't complete it. With that, you are keeping the malaria in circulation in the system. So we take part of the responsibility. Apart, the mosquito is not actually the cause. The cause is actually Plasmodium, which causes the malaria itself. But part of the things we do will determine whether the Plasmodium will keep on spreading or
not.
It will disappear from our society. So we all have to take responsibility. All
right then. So let's look at some of the misconceptions around malaria and how we can correct these misconceptions.
Some people have malaria. They will tell you it's when I take agbo that the malaria will work, that they will be properly treated and things like that. Well, the truth is, it is not every fever that is due to malaria. Like I stated earlier on, some people will have fever, maybe just from flu, viral illness.
Okay.
That ordinarily will go on its own, whether you take the drug or not. But now you are taking agbo for it. So you will damage your kidney a bit. And at the end of the day, the viral illness will go on its own. You say, I've taken the agbo, utalenu, but, so you didn't really treat malaria. You have fever and you think it's malaria. You took herbs, whatever, and the viral illness went on its own. But with that, you have damaged a part of your kidney, and you continue with that lifestyle. At the end of the day, you come and meet us in the dialysis center, and you are crying. So there is no place for agbo in the treatment of malaria. Even if you see the way they prepare it and things like that, there is no place for things like that. I think that's the common misconception that is around for malaria, people using agbo to treat malaria and things like that.
Let's look at the importance of pregnant women taking malaria prevention seriously and for children under 5.
Okay, when it comes to malaria, we are particular about pregnant women and children under 5. Because when we look at Nigeria is a country that is endemic, known for malaria. So most of the time, by the time you grow to a certain age, you are 10, 15, 20, you have some form of immunity. But for pregnant women, kind of they have lost that immunity, because the process of getting pregnant is that the woman is taking sperm from the husband that is not part of her own body, that the sperm is foreign to her. You know, during the formation of the baby, for the woman's body to be able to accept that baby that is foreign from her, the immunity has to be down a bit to allow for something that is strange, for something that is foreign. So pregnant women have a reduced immunity for them to be able to accommodate the baby. During that period when their immunity is down, their defense is down, their guard is down, if that woman should get infected with malaria, the symptoms tend to be more severe. And you are wondering, is it not Yasikira that has treated malaria how many times? Why is this malaria now different? You know, and because the malaria itself, when you deal with pregnant women, you are dealing with two people.
Sure.
The woman and the baby. The malaria itself can make the baby not to grow well. Before you know, the woman will have premature delivery. The child can have low birth weight. If the child is supposed to weigh maybe 2.5 kg, you are seeing a child of 900 gram, 1 gram, premature. Whether the child will survive it or not is here, you know, we don't know. So it poses risk to the baby, poses risk to the woman. For a child that is under 5, that child is still developing immunity.
Okay.
So their immunity is not fully formed. So you want to be careful with this particular age group. That is where we record most of our malaria deaths. So if they are sick, they are not the type you want to gamble with. Go and give agbo and all those things. Their kidney is not well formed. You know, and you are not treating the malaria well. They are likely to come down from that malaria. Also, the third group is people that are not used to our environment. Nigeria is a raining thing now, so everybody wants to be associated with malaria. Anthony Joshua is currently in Nigeria now, you know, but he has not really lived in Nigeria for many years and things like that. What do you think his immunity will be? I don't know if he has ever had malaria or not. But if somebody like that should get infected with malaria, it will be very severe, because he has not built the immunity that you and I have built over the years. You know, so these three groups, people that do not live here, have not lived here before, they are coming here maybe for vacation or dirty December. Children under 5, pregnant women, their immunity is not as high as ours.
All right. It is at this point I'm going to use the Fire Williams language. Mama Sikira, Mama Bomboy. You need to pay attention to those children of yours under 5 that you give all sort of concussion, right? It's very, very important that you pay attention to their internal organs, right? You don't want to gamble with all of these. One last question before I let you go, Doctor. One thing we usually, place a premium on in this part of the world is insecticides, right? We believe so much that when we spray, it kills mosquitoes and all of that. Are we concerned about inhaling some of these things? How long should one consider, or should one stay away from that environment before you go back into that room, before you sleep in there, especially for children as regards their internal organs?
Usually what I advise is, whenever you want to fumigate your environment, spend a couple of days outside that environment before you do it. Usually some
people spray insecticide every night.
Well, that's not a good practice, because most of these insecticides
some people use coil every night.
They contain organophosphates, and as we can see, some people use a particular brand of insecticide, very popular for committing suicide. I don't want to call the name so that somebody that is thinking of suicide will not go and look for it. You know?
Yeah.
But we can see that even the insecticide itself can kill. So it is advisable that when you want to use it, you use it when maybe you want to travel, spend some days, weekend away from that place. And even when you come back, you can now open your door, but still you open your window, but make sure the net is covered so that some of it will go out. Put on your fan and everything, so that, you know, by the time you are coming in, that smell is down, the concentration and everything is down. It is the mosquito you want to see is killed. It's not suicide you want to commit.
Whether it is odorless or not.
Whether it is odorless or not, yes.
All right, then. One last thing from you, Doctor. What would be your advice to Lagosians and Nigerians as a whole? This is malaria, and of course, it concerns all.
Well, when it comes to treating malaria, it starts with you. Very important. Please, if you have malaria, make sure you take your drug as recommended by your doctor. Use the complete dosage so that you don't build resistance. If you don't take care of yourself, you pose risk to yourself and to the people around you, your loved ones. And that is why we are having drug resistance. Take care of your environment. If you treat your malaria very well, mosquito will not say anything to transfer from you to me. It is very, very important. We have done very well in the fight against malaria, but I'm sure we can do better. There's this popular saying, no matter how good you are, you can always be better.
All right, then.
We have done better so far, but we can be the best.
We'll leave it at that now. For now, thank you so much, Dr. Kelvin Isibo. Today on Safety Train, we have discussed World Malaria Day, accelerating the fight against malaria for healthier future. And this is where we drop the anchor on today's edition of the show. Maximum thanks to you, Dr. Kelvin. I should say a very big thank you to Debbie Bolodioku, also of the social media unit. Big ups to you, Victor Terry. Our executive producer is Taya Conley. My name is Taiwo Baruwa. This program has been supported by Rely Supply Limited, providers of first aid boxes and training. For brand promotion on the radio or to access our services, call 0818 131356 or 0908 629 7109. My name is Taiwo Baruwa. The program makes a return next week. God's willing, Fire will be here to take you up on that on the program next week. Enjoy the rest of your evening, Lagos. But I'll still be very much within to take you through the Lagos metropolis on return trip.